You'll hear a lot of talk about AI being revolutionary. I actually not sure if I agree with that. I think the evolution of AI is all about operational efficiency. I can see a lot more workflow automation. I can see a lot more natural language communications with patients, and with accents and other things, you can start getting a capability that can do care management, case management, even digital outreach. I think AI is going to drive significant efficiencies there and start driving down the cost of delivering care management and case management. I think it's going to automate a lot of the prior auth, the pre-auth work, a lot of the insurance verification work. All of these things are elements of some types of CRM. So I do definitely see AI being an operational expander or a value add. I'm not sure if it's a significant next step in a next generational event, but it's certainly an operational efficiency, which I think is going to be a tremendous value add.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals, enabling them to improve care delivery through integrated design and technology innovation. My name is Greg Malkery, and joining me is my co-host, Keith Washington. Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, then you're in the right place. Let's explore together what's possible when we go beyond the blueprint. Well, I'm pleased to introduce our guest speaker, Kevon Kothari, a distinguished executive with deep domain knowledge and expertise in deploying CRM systems. Kevon, welcome to our webinar. Would you like to introduce yourself?
Yeah, so my name is Kevon Kothari. I'm the president and CEO of CERTIFY Health. We are a patient engagement platform, but have significant experience in the past in all things patient management, care, and patient nurturing through the process of payer provider care. CRM is a broad topic within that umbrella and that roadmap and that journey. And I've been involved in CRM-like topics for about 20 years in healthcare.
Keith, do you have any opening remarks?
Yeah, sure. Thanks, Greg. Yeah, so I'd just like to remind everybody about that Beyond the Blueprint is a conversation about design, which we like to think of as managing complexity, and that a good design really helps an organization focus on their mission, but allows them to be flexible with their plans, but transparent in their communications, where they're trying to address opportunities and challenges for both staff and patient that are looking for leadership to manage change and adopt new processes and workflows. So as a business leader, today's topic I think is really exciting. It's really a priority. So I'm really curious to learn more about CRM and communications in healthcare.
Now, before we dive into today's discussion, I want to recognize our valued sponsors who've made Beyond the Blueprint possible: Storage Systems and Simplify Medical. With their support, we're able to bring you insightful conversations around healthcare design and innovation. If you enjoyed today's show, I encourage you to subscribe so you never miss a future episode. Now, during today's webinar, Kevon's going to explore innovative strategies in using CRM systems to help transform healthcare delivery. He'll highlight the benefits of using CRM tools to improve communications, streamline processes within different healthcare settings. So with that, why don't we get started, Kevon? Considering the diverse needs of ambulatory settings, clinics, and physician offices, how do you approach the systematic design of CRM tools to ensure seamless workflow integration?
Good question, Greg. I hate to say this, but it all depends. It all depends on exactly what the system wants to achieve from their end state. What are the key KPIs they want to measure? What are the interaction touch points that they want to enable and streamline throughout the process? So ultimately, the things that you need to include in a CRM is from the beginning, let's call it the front end of patient engagement, is how do you start to identify who your patients are, the population you want to be engaging with at the beginning, and how do you communicate with those patients? Is it through online, digital, social, or are they already part of your health system, or are they already an actual patient? So looking at the front end, identifying and nurturing the front end of that patient, let's call it that journey, all the way through the ecosystem of their journey, be it a hospital, be it a care manager, a case manager, be it a dietitian, a nutritionist, understanding the touch points along the way and making sure that you've built a system, a capability or system or a platform that allows you to be able to nurture that patient journey throughout their entire, let's call it, visit with that their time with that institution.
Do you think you could share maybe a specific customer example where CRM deployment led to improvements in patient outcomes and satisfaction?
Yeah, so I mean, there's a lot. I'll use I'm not going to say specific names, but a specific academic medical center that we worked with. This was in a prior engagement in a prior life, more on the care coordination side of things. So post-discharge from a surgical event, the CRM system fully integrated into their Epic instance had the notes and the procedures that were followed for the surgical event. And the CRM platform was designed in a way to build a care plan essentially for that patient to be able to say, post-discharge on day one, here are the things you should be looking at. Here's the signs and symptoms you should be seeing. If there's any deviations from it, here's a plan of action that you should take. Day 2, what you should do. Day 3, hey, day 5, it's time to schedule your PT. Hey, we've interacted with CVS to make sure your prescription was refilled. And building that automated capability post-discharge improved overall globally across all of their surgical outcomes in that specific area. It improved their recidivism, it improved their readmission rate, it improved their outcomes as well. So in a value-based, this was not a value-based program, but in a value-based care program, you would have seen significant outcomes and significant ROI. So this is a program that was deployed across the entire population for individuals in this specific surgical instance. But it was an area where you could take people out of the process. You weren't making phone calls. You weren't engaging that patient unless you absolutely had to engage that patient. That patient was doing proactive outreach, but you were able to deliver a capability at scale that was completely streamlined and allowed that patient to feel like they were educated along the way and be able to manage themselves along the way after the discharge process.
I think offline, you also told me about another compelling example about a diabetes management clinic that might be useful for our viewership.
Well, so I mean, it's a very similar example. So individuals with diabetes, it's one of these where there's a high prevalence of diabetes. The level of education on what diabetes is also lacking. So building it another version of a care plan, CRM tools can bring all the data in from labs, from the existing scripts, existing medical records that may exist, and be able to create a longitudinal care plan for a patient to be able to be, let's call it, initially nudged into understanding what their potential condition is, in this case, diabetes, educate them on the foods that they may be eating that are affecting them, understanding insulin and what insulin is and how the insulin levels are affected by their diet, their exercise, and their overall lifestyle, and then building out from there based on specific cues, specific agendas, specific feedback from the patient, a care plan that can help them self-educate themselves and potentially operate themselves in a better overall longitudinal basis to be able to improve their outcome. So we're seeing a lot of these automated digital diabetes programs, Verta Health, Onduo, others are out there that have been refining these tools and these capabilities. And Livongo is another example, and are delivering these types of programs at scale in a highly automated and efficient manner. You're seeing in a lot of these instances significant improvements in health, wellness, and outcomes.
Wow, I'm still waiting for this to come to a health system near me. I think it's useful to hear. What common operational challenges do clinics face when trying to integrate these CRM systems within their existing workflows? And can you share some of these strategies in overcoming some of these barriers?
Well, so this could be an entire topic all on its own. But so I think the biggest problem and the biggest first barrier is this is how we've always done things, right? So figuring out a new way to operationalize your capability, CRM is just it's a word. It's relationship management. Today healthcare is very one-to-one. It's very patient, provider, practitioner, clinician engagement led. Integrating a new capability, a capability that is not necessarily one-to-one, but one-to-many or many-to-one is new, and it's scary, and it's something that it creates a barrier to entry. I think that's your first one, is that the reduction of the one-to-one, I think, is your first big issue. The second big issue, honestly, is data. What kind of data do you have? Where do you get the data? How do you consolidate the data from all of the disparate systems? And how do you harmonize that data to create a profile for that individual patient that can be meaningful? And that's not only EMR data, but that's potentially patient activation measures. It's potentially other other potentially psychosocial measures that you might need to capture to be able to actually build a care plan, build a capability to be able to identify and manage that patient in a way that is attractive to that patient.
You raise an interesting point. So there's the idea of staff engagement, but there's also the idea of patient engagement. Can you get patient engagement if you don't have staff engagement?
That's right. That's right. And so the staff is leading the charge here, right? They're the ones that are understanding the dynamics, how to talk to patients, how to communicate with patients, how to engage those patients. They are absolutely critical in the upfront setup of the, let's call it, automated workflows that CRM can deliver. So you take a one-to-one approach, you can take it to one-to-many, but even one-to-many needs to feel like a one-to-one approach. And so you absolutely need staff buy-in to be able to build that one-to-one approach or that one-to-many approach in a I'm going to use the word nurturing a lot, in a nurturing manner.
Without a doubt. But it's interesting that as an end user, we all have different capabilities, wants, needs, and desires, which can be based on technology literacy, health literacy, etc., and figure out what the appetite is and not overwhelming the end user, which can be quite challenging.
Absolutely. I mean, so, and again, in healthcare, you have users that are highly tech savvy and users that are not. And that's across all spectrums of age. So being able to identify not only the specific patient, but potentially their care support network as well around them to be able to continue to keep the entire network of people that are supporting that patient educated, informed, aware, and bought into that care. So it's not, again, it's one-to-one, one-to-many. Typically a case manager, care manager, clinician is not just managing the patient, but also managing the network around that patient to make sure that they're delivering care in an appropriate manner.
How do you actually address or orchestrate the change management as it relates to staff, but also relates to patients? How do you get them to buy in that this is now a new standard care? So that patients not only expect it, they're actually looking forward to utilizing it to be part of the care process.
Yeah.
And there could be some generational issues here.
And so this goes back to it depends, right? So every use case, every deployment, every potential model is going to be slightly different. And the use case and the desire to adopt and want to scale is going to be different. So you have to, a lot of it comes down to education. A lot of it comes down to how do we optimize and make your job more efficient? How do we help you manage the highest risk patients in the most efficient manner possible, but continuing to manage your triage list? You have, you manage 1 to 500 to 2,000 patients. How do we make sure that we are identifying the patients at most risk earliest so you can spend your time there and but still making sure that the patients that are less risk are being managed and taken care of. So part of it is an education process. Part of it is an adoption and deployment process. Part of it is a training process. Part of it is just, it's a making sure that you are communicating that you're on the same page as they are, right? So and the people that need to be able to provide their services to a population that's somewhat overwhelming sometimes, right? So managing a 2,000 person triage list is not simple. So how do you help them become as effective as possible in managing that list?
From a healthcare leader perspective, how do we measure the success and ROI of a CRM system as it might relate to patient engagement, clinical outcomes, operational efficiency? Are there any specific metrics or KPIs that you guys have utilized that have been insightful for the organization?
Yeah, so it depends on the type of organization. Again, I hate going back to it depends, but it really depends on what the actual implementation of the CRM was for. So sometimes we have deployments that are purely based on revenue cycle. And so how do I ensure that the customer is aware of their potential outstanding balances? How do we provide transparent bills before they come in so that we know exactly why that patient's coming in? So can we provide insurance verification and insurance estimates that allow them to know exactly what their payment's going to be so they aren't surprised? So measuring education, transparency, measuring the payment rates, measuring how often that they are being, let's call it, nudged along the process to make a payment, or that they are aware of the payment. So a CRM platform that's purely for revenue cycle has a different potential set of KPIs than for care management and case management than it is for patient acquisition and activation. So it depends on the use case that you're looking at, what the target market is, and exactly what the ultimate outcome needs to be. So the KPIs are going to be different across those three, let's call it, primary vectors.
What are the key KPIs or metrics today that are driving sales of CRM products? Is it around around revenue cycle management? Could be around payment. Is it about reminders? Well, what is the key drivers today that is incentivizing healthcare organizations in various settings to actually make the investment?
Yeah, so I think on the, let's call it the practice level, the independent physician groups, I think it's actually about filling the top of their funnel. They're trying to attract and retain patients, right? So the KPI is how many new patients can I deliver into my organization, and how can I keep those patients satisfied for as long as possible? So the CRM tools, the CRMs are built around identifying patients online through their journey on the web as well as offline. How do I capture their information so I can engage with them through text, through email, through other means? How do I continue to track those patients? And how fast can I turn them into an actual patient on the front end? And then on the back end, how do I communicate with them? How do I put out the reminders? How do I do birthday reminders, appointment reminders, post follow-up visits? How do I continue to keep them engaged to make sure that they are getting the care that they need on the front end? And then on the back end, how do I continue to remind them that they need to continue on their care journey? So, and how do I make sure that I can drive satisfaction as well as part of that care journey? I think that's at the individual practice level. RCM is also involved in that as well, to make sure that there's price transparency for satisfaction, and that the consumer and the patient is aware of what's going to be their procedures, what's going to happen in a clear and transparent way. Those are all kind of KPIs at the individual practice level. I think for, let's call it, health systems, the KPIs are going to be different, right? It's less about acquisition, it's about retention, it's about satisfaction, it's about care management and case management. And so it's not only retention-driven KPIs, but it's also about outcomes-driven KPIs. So how do I improve my case management, my care management, my care coordination? How do I make those things more streamlined, more efficient, and get a higher return on that investment the CRM is going to provide or try to provide?
I think you're bringing up some really good points, because in my neighborhood, I have a lot of docs who have their own practices or very small, and a lot of them are inefficient. They use FTEs to accomplish a lot of these capabilities. So it seems that as private equity is coming in and acquiring and aggregating these practices, this seems to be a slam dunk for private equity, right? In providing the operational efficiency to address issues that were normally handled by full-time employees.
Yeah, absolutely. Well, it allows the full-time employees to actually be focused on patient care, and you're exactly right, to streamline typically the phone calls, the scheduling, the prior authorization. CRMs can help streamline a lot of that, automate a lot of that process, and allow for the front desk staff, your RCM staff, your office managers to focus on the patient and less so on some of the inefficiencies that are in the practice level operations.
So Kevin, just a couple follow-up questions on some of the stuff you were talking about on the particular, like the, say the physician office versus the big sort of enterprise level health system. So I guess, where do you think we are with CRM? Is that an area where adoption and execution and implementation, say the physician office side, on a degree of difficulty, is that a little easier? Do you see, like, in the market, is that really more where you expect, say, broader scalable adoption is going to occur, and then it moves into the big health systems? Or I guess, yeah, give us your sense of that kind of adoption curve.
I appreciate the question. So I do think that I'll call it a package solution at the individual practice level or the scaled practice level. There's a specific set of needs, specific set of requirements, and it's pretty similar across all practices. Where in the health system world, they're still experimenting with CRM. They're still figuring out exactly how to integrate across the health system. It's a lot harder and requires a lot more customization. So I do see the scalable solutions for CRM much more at the practice level, given the fact that it's much more of an out of the box solution. I think CRM is still in the early phases across all healthcare, and we're still evolving what CRM can do and how it's going to be deployed. I actually don't believe it's going to be called CRM in the near future, right? Patient relationship management. But even beyond that, it becomes just care management. How do you manage care at a macro level? CRM is just one tool to manage care.
Yeah, and that's very helpful. And I guess on the other use case you cited as an example, sort of the diabetes patient. So I guess, where are we on that spectrum to say, if we have somebody with diabetes, obviously they pretty familiar with lots of frequent encounters with the health system. But let's say bringing in other conditions and care, I guess, where are we on that in terms of, let's say not just diabetes, but a whole other long list of ways we can help patients navigate the complexity?
Yeah, I mean, chronic condition management. I mean, so if you look at the tools that existed 20 years ago where I started, RPM, telehealth, telemedicine, it was all focused on multi-comorbid patients, right? So this is the more complex patient you get, the more value you can see out of scaling limited resources. So we went from a highly one-to-one model in chronic condition management 25 years ago to a one to several with case management and care coordination and RPM. With CRM and other digital tools, especially at let's call it the beginning of the tail where you start seeing 3, 4, 5 chronic conditions per individual, you can start using these digital tools, the digital outreach, let's call it the automated care management plans at scale. And so you can go one to many, not just one to several. So what CRM is doing, what care management is going to do in these tools are doing is helping drive one to many, allows you to scale a finite resource in terms of people to be able to manage a large demographic, a large population for chronic condition management.
Great. Thank you.
Hey, Kevin, let's talk a little bit about technology. What are the biggest impact as it relates to ambulatory clinics or physician offices over the next 12 months? What technology do you see most promising? And you did raise a valid issue earlier on. It depends on what the KPI is. Is it around clinical? Is it around revenue cycle management? But are there specific technologies that hold promise, and what might they be used for?
So when you say technologies, let's go down the path a little bit. What do you mean by that?
This could be things like the use of artificial intelligence, machine learning, could be around the use of blockchain technology around security, could be Internet of Things. Are there any specific technologies that you get excited about that you think could be disruptive for this segment I think just labeled PRM? And guys, you heard it today. PRM is the new category.
So let's see if we can get that to be proliferated. So in general, I mean, you'll hear a lot of talk about AI being revolutionary. I actually not sure if I agree with that. I think the evolution of AI is all about operational efficiency. I think AI will be great. Natural language processing, natural language speech, call center capabilities, where CRM is a long tail type of product. CRM call center is part of that, up at the front end of it. I can see a lot more workflow automation. I can see a lot more natural language communications with patients that is more engaging, more natural for the patient. And it seems like it's more of a one-to-one. AI can certainly help scale that. It becomes much more natural. It takes input better and can repeat and respond to that input in a way that's much more natural and human-like. And with accents and other things, you can start getting a capability that can do care management, case management, even digital outreach to patients that maybe abandoned an online schedule, or just that needs some level of outbound communication. I think AI is going to drive significant efficiencies there and start driving down the cost of delivering care management and case management, and let's call it the tail end of population health management, which CRM certainly is a tool that fits into that. I think it's going to automate a lot of the prior auth, the pre-auth work, a lot of the insurance verification work. I think that's another area. Provider credentialing is an area where AI is super valuable. All of these things are elements of some types of CRM depending on the use case. So I do definitely see AI being an operational expander or a value add. I'm not sure if it's a significant next step in a next generational event, but it's certainly an operational efficiency, which I think is going to be a tremendous value add. But I think I think the cell phone continues to be a technology that is underutilized in care. So I see more delivery of push messages, text messages, just digital workflows and management of patients. I think patients, especially as our generation, your generation are aging, are much more comfortable with the delivery of information on their phones. And I think that we are underutilizing the opportunity of mobile and digital delivery of communications and care and management of patients on their phones and mobile means.
What about the intersection? I know that's an area that's near and dear to your heart. The intersection of remote patient monitoring, wearable technologies with these CRM systems, right?
Yeah. So
are we ready to go mainstream, or are we still in an emerging category?
I think we're in an emerging category, and I think we'll be in an emerging category for years. Healthcare is not fast to move on any topic. So this is when I managed remote monitoring programs 15, 16, 17 years ago, we basically built a scaled model of a CRM tool. That's what it was. It was a natural processing language. It was a care management plan. It was branching logic with a wearable technology, non-wearable technology, and data aggregation capability. It was a CRM in one form or another. It did case management. It did care management. It did chronic condition management. It did data management for peripherals that were in the patient's home. It did psychosocial management. CRM is no different. It can do all of those things today, and it's all about how you choose to manage that data and how do you choose to drive the next best decision from the data. And so in RPM, it was very person driven. After we got the data and coordinated that data, somebody had to look at that dashboard, look at the triage of that data and assess who was at risk and who wasn't and what to deliver next. Other tools and CRMs with some AI capabilities will be able to scale that capability in a much larger umbrella. And you'll start being able to automate some of that next best step versus having human intelligence do it. You can have artificial intelligence do it.
I think you raise a valid point. I just got this new Samsung watch, a little advertisement for Samsung here. I still don't want to use the same capabilities, right? I can tell the time, I can take my steps, and I know the weather. That's about it. It doesn't matter how many things they pack into there. I still only use a very few or limited capabilities.
That's right.
But everybody's got it. We just don't use it for health at this point.
Well, even if you chose to buy it for health, like I had a Withings watch that I used the ECG on all the time and the pulse oximetry on. When I first bought it, I probably used it every day for 30 days. And then after about 30 days, 35 days, I stopped using it. Like it was a novel thing that became less novel. So how do you take those things, those tools, those capabilities, that data that you currently have or are using, and how do you use that how can the health system use that in a meaningful way?
Well, there has to be a specific purpose. Like you look at Stanford and they have a 400,000 person trial using the Apple Watch for AFib patients. It's a distributed clinical trial. Yep. I think that's compelling. I get a reason to use it. I have a daily log that I'm required to do as part of the clinical trial. So there has to be a purpose and there has to be a structure. Otherwise, it does get old after a couple of months.
That's right. Well, beyond the purpose, like you actually opted into the clinical trial, number one. So you had a purpose, and then they keep prompting you to make sure that if you've missed something, that you are doing what you need to do. And that's any well-designed RPM program does the same thing. That's just a CRM activity, right? Noticing a flag or trigger on a patient that didn't do something and making sure that you nudge them in a way that makes it compelling for them to want to go do it. Having patient activation measures.
The community would say was harassment and not engagement, but yeah.
Well, luckily you opted into that harassment, so it's okay.
Yes, 100%. Well, Kevin, that's all we have time for today. I'd like to thank you for sharing your time, your insights and perspectives. I also want to thank our valued sponsors, Storage Systems and Simplified Medical, made this conversation possible today. Kevin, you want to provide us with any closing remarks and maybe tell us a little bit about you and CERTIFY Health?
Yeah, so I mean, at a high level, I've run CERTIFY Health for the last 9 months now. CERTIFY Health is a patient engagement platform primarily focused on patient acquisition, digital forms, digital intake, and we have a full revenue cycle suite as well. So we're helping practices, individual independent practices, streamline some of the upfront operational inefficiencies that are in the health systems. Digital forms that we map data right back into the EMR. We make sure that we present highly educated material that educates the patient on the procedures as well as the payments that might be outstanding, and then making sure that they can schedule their appointments in a way that is convenient to them. So that's kind of what we do. All kind of components and capabilities of a CRM system or a basic CRM system we're providing to organizations that are a little bit smaller and might not be able to afford the full-blown sales forces of the world.
And how can folks find out more about CERTIFY and get through to you?
Yeah, so it's www.certifyhealth.com, and I'm at KEVON at certifyhealth.com. So I'm happy to have anybody reach out that might be interested in talking a little bit more. This is a great topic. I appreciate Greg, Keith, Lars for having me talk about my expertise and my background here. We just touched the surface level of CRM. There's a lot more that we could talk about. So I would be happy to have further conversations and happy to talk to anybody else offline.
Great. Hey, Keith, what about you? Do you have any final thoughts on today's webinar topic?
Yeah, no, I really appreciate this, Kevin. It was really great. I'm really encouraged by the clarity that you're able to articulate the benefits using CRM in the examples that you shared with us, and I just think it's a great example of leadership where you can tell you have a passion. It's inspiring to hear about the work you're doing. And I think, this conversation really it casts a vision for a positive future where we can see better care team coordination, health system navigation, because we know how challenging that is. So really appreciate the work and the passion. And I really like the new definition, the PRM. I would say I like the idea of thinking about PRM leads to CRM, but CRM means care resource management.
That's right.
So then you really then can drive value by integrating these tools. So again, I hope you'll come back. I'd love to keep this conversation going.
Absolutely.
Well, thanks, guys. For those of you in the audience not familiar, Spyglass Consulting is a product and go-to-market advisory firm. We're focused on emerging and disruptive technologies in healthcare and life sciences. We proudly serve more than 250 leading entities that include technology companies, management consultancies, healthcare providers, and investment organizations. We published more than 30 market research reports on a diverse set of informatics-related topics, extensive library of pay research, and to gain a deeper insights into how technology is reshaping healthcare. I encourage you to visit my website at www.spyglass-consulting.com. So with that, that's a wrap for today. We look forward to continuing our conversation. And Kevin, we do hope you come back to continue the conversation and let us know how you're doing at CERTIFY Health.
Sounds great. Absolutely. Have a great day.
Thanks, everyone.
Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.